National Nurses Week is underway, as is Stroke Awareness Month. It's a time to recognize all the hard work frontline workers do, as well as raise awareness about these signs of strokes. We're going to do both right now with board-certified nurse practitioner Jason Gleason. Good morning, Jason.
Good morning.
So what role do nurses play in frontline health care?
You know, nurses are a vital link to our healthcare system across the country, coast to coast, especially over the last few years of the COVID-19 pandemic. So absolutely, you know, nurses in hospitals and primary care, nurse practitioners like myself are all working together. And there's 4.2 million nurses in the country today providing exceptional care for our patients.
What has your personal experience been like working as a nurse practitioner in military and VA settings?
You know, serving in the military was the greatest honor of my life. For 20 years, I served in the military as a nurse and as a nurse practitioner. But now I get to take care of our national heroes at the VA, and there's no greater honor than that. It's such an honor of my lifetime to go to work. I don't have to go to work every day. I get to go to work every single day and take care of our national heroes, and it's the best job I've ever had.
What an outstanding outlook. You mentioned nurse practitioner and nurse. What's the difference?
You know, nurse practitioners, we're all nurses, and we're proud to be part of this amazing profession, but each of us have a different role. So a nurse practitioner is somebody in our profession of nursing that can order tests and refer patients and prescribe medications and take care of their general health needs, as well as needs in acute care settings. In primary care, I see patients on the front line a lot of times and chronic disease management like diabetes and hypertension. So just providing comprehensive healthcare services for our patients.
And why do you think it's so important to recognize the work being done by nurse practitioners like yourself?
You know, that's a great question. You know, this is National Nurses Month, and it's such a great opportunity for those in our entire country to reach out to our nurses, true public servants, and just tap them on the shoulder and say, hey, thank you for what you do. And it doesn't take much. That simple act of gratitude can just charge us up and energize us to stay in this fight and to keep providing the great services that we provide for our nation.
Absolutely. Thank you, and thank you to all the nurse practitioners out there. May is also Stroke Awareness Month. You're probably the guy to talk to about that too. What are some things people can do to reduce the chance of suffering from a stroke?
You know, I have an interesting perspective on stroke. I know it as a provider taking care of stroke patients, but I also am fully aware of the devastation of stroke. My wife in 2011 suffered a devastating stroke at just turning age 40, and she did not have any risk factors for stroke. She was in great health. And out of the blue, she had this devastating stroke, and it just left my boys and I absolutely shattered. We had 3 young children, 7, 10, and 14. And so picking ourselves up from the most devastating loss of our lives, we decided, you know, we're not going to let this loss change us, but we're going to let this loss in some way change the world in some positive way. We wanted to make an impact on stroke care across our country. And so using our loss is a great opportunity to make a difference. And that's hopefully what we did.
How are you able to do that? How are you able to make that difference now?
You know, initially after she passed away, you know, we had to spend some time recovering from our loss as much as we could. But then we hit the ground running, and we developed a stroke conference for our state, which was regional. And now we have an international audience coming to the Rocky Mountain Stroke Conference held every May. It's an annual conference to bring together nurses and providers. I also speak on the topic at my national professional organization, the American Association of Nurse Practitioners. Our national conference is coming up in June. And so it's such a great opportunity to get the word out, to empower people to knock out stroke, crush disabilities, and live their best life.
Well, Jason, thank you so much for sharing your story with us, and thanks for all you do.
Thank you very much. Appreciate you.
And thanks to all the nurses and nurse practitioners out there.